Hello everybody, I am Dr. Vandna Narula, Senior IVF Consultant at Motherhood Fertility and IVF Center, Chandigarh. The reasons of female infertility. For that I just have a model of a female reproductive system, and I'll explain little bit by bit. This is the uterus, these are the fallopian tubes, and these are the ovaries. Naturally what happens is, every month each ovary produces one egg which is released and is picked up by the tube. It comes here and the sperm naturally gets deposited here and it swims up, reaches from here to here, and at this place roughly fertilization occurs. The embryo that is formed on day 5 forms a blastocyst and it gets implanted in the endometrial cavity here, and after implantation it grows and forms a baby. So whenever there is any structural or functional defect anywhere in the system, that leads to infertility. The patient is unable to conceive. Now here we will just focus on the female reproductive system problems, or all other problems in the reproductive tract of the female and in the body which leads to infertility. First of all, starting from the vagina. If there is any structural blockage in the vagina, the sperm cannot get deposited here near the cervix. So when the sperm is unable to swim up the cervix and reach the tubes, fertilization will not occur. Now we come to the normal uterine cavity. Normal uterine cavity is shaped as such. In certain patients, the cavity is misshaped, like it might be unicornuate, or it might be double bicornuate uterus, then also, or there might be a septum inside, then also there is difficulty in conceiving. There might be structural problems like a fibroid which might obstruct the cavity, then there might be a polyp, or the lining might be very thin which doesn't allow implantation. Then comes the fallopian tubes. Fallopian tubes need to be open for natural fertilization to occur. And even for IUI to give positive results, we need to have open fallopian tubes. Because of any reason like infection, previous infection, or endometriosis or adhesions, the tubes might be blocked. Tube might be blocked at any point. Then what happens is, the sperm is unable to travel, the egg and the sperm are unable to meet. The natural site of fertilization is blocked, and this hinders the natural fertilization and resulting infertility. Now we come to the ovaries. Ovaries are the seat of gamete formation. What might happen to the ovaries that might lead to infertility? First of all, the ovaries might be very small. When we say the ovaries are small, this means that ovaries do not have the required number of follicles, the required number of eggs. The eggs are low in number, low in quality. Naturally, what happens is, it happens during aging. As the lady ages above 35 years, the ovarian reserve goes on decreasing, and less number of eggs are available for fertilization. So ovulation problem is there, means there are very few eggs which ovulate, and that leads to resultant infertility. Then the second, there might also be cases of premature ovarian failure, wherein at a younger age menopause occurs. The ovaries stop producing eggs and the hormonal imbalance is such that the lady is unable to conceive. Then comes another problem which is commonly seen, that is PCOD, polycystic ovarian syndrome. In polycystic ovarian syndrome, there is asynchronous production of estrogen and progesterone. The FSH and LH ratio is imbalanced. The testosterone levels are slightly at a higher side as there should be in a normal female, and that leads to failure of ovulation. There is failure of ovulation and there is menstrual disturbance, and because of that there is less chance of conceiving in the female. Then structural defects might be there in the ovary. There might be chocolate cyst, there might be dermoid cyst, or any other cyst might be present. which again may lead to failure to ovulate, and these reasons might cause infertility. Apart from all the structural and functional reasons which I just mentioned of the reproductive system, there might be other hormonal changes also in the body, like thyroid problems, hypothyroidism, hyperthyroidism, or hyperprolactinemia, which might interfere in the normal reproductive cycle, normal ovulation process, and that again might lead to infertility. Thank you.